Surprised the audio didn't catch us in the segment that we don't do, that is being naughty with Mackie. But on this Wellness Wednesday, fitness and nutrition expert Mackie Shilstone joins us to explain the new blood pressure guidelines for the first update. It's the first update since 2017, so this is a big deal to break down here for folks to know, because people don't even know sometimes you're walking around with high blood pressure.
Well, you know, Brandon, you're right. I mean, the American Heart Association, the American College of Cardiology, as you said, came up with some updated guidelines. 120 million people in this country have elevated blood pressure. That's 48% of the population. What is staggering is 11 million of those 120 million don't know they have high blood pressure. And more importantly, 1 in 4 that do know it don't have it in control. So the first treatment guidelines that have been updated, you see the 130/80. The 130 is the top number, systolic. Right. That's the pressure in the arteries when the body pumps. And the bottom number, that 90 or the 80 is basically the pressure in the arteries during the relaxation phase. So the treatment guidelines got updated that if you can't have your blood pressure under 130/80, and now the target is really 120/80, then there is, after 3 to 6 months of lifestyle changes, it's probably some intervention. And then secondly, if you have diabetes, heart disease, or kidney disease, they may intervene. They're going to intervene early.
Mackie, that's alarming, because if ultimately that easement has been made there to essentially make for more people to fall under the category of having high blood pressure and potentially not know that they do.
Well, it is a staggering number. That's why it's called the hidden disease. Now, there are some guidelines now on what we do about it. We have some to show you. Basically, it's looking at the DASH diet, the dietary approach to stop hypertension. The DASH diet, as you can see, is fruits, vegetables, low-fat dairy, beans, fish, and nuts. Here's the kicker, though. Getting your salt intake, sodium intake, under 150 milligrams a day. Typically, the recommendation has been under 2,300. Now it's come down. You're going to stay active, healthy weight, manage stress, limit alcohol, and then pregnancy, the monitoring of blood pressure early. So these are the new guidelines, and everyone should be urged, if they fall into the category, especially you can't get your blood pressure down under that 130/80 toward 120/80. That's where you want to be. It's time to talk with your doctor. It's really key. Let's even lower that number to 120, right? 120/80.
And talking about that salt, I mean, the salt consumption is really big here.
Well, the dietary approach to stop hypertension has been proven in research studies time and time again to be the most effective diet to reduce blood pressure. In fact, there is a MIND diet that is a combination of the Mediterranean and the DASH diet, and it's a blend of both to improve cognitive function. Your elevated blood pressure is going to increase your risk to dementia.
All right, what are other ways we should do to make sure that we keep on top of this?
Well, the first thing you want to do, as we talked about in the lifestyle guidelines, I was talking to Brianna before we came on, that targeted exercise at a heart rate below a breathless state. Secondly, the DASH diet. Thirdly, learning maybe some meditation, a simple 5-minute meditation. You can Google that on the internet, because that's going to improve what's called your parasympathetic nervous system, and that's going to drop that lower number. A lot of times in science, that number on the bottom has been discounted, but I can tell you, activating the parasympathetic nervous system is going to help deal with the built-up stress that many of us have. You know, mortgage, stress at home, whatever it may be, just living our lives, looking at the news.
Right. Yeah, it does. You tell us about it. All right, good sir. We do thank you for coming in and sharing those tips. Also, podcast going well, you and Spencer?
Well, you know, there are a lot of injuries in the NFL. I used to do it for the Washington Post, so yes, there's always business.
All right. Well, good to see you, good sir.
Thank
Thanks again
you.
for being here with us this morning.